I'm Claire Deneen. I am the person behind the Bitchin Chickens blog. I have an eclectic science-based blog with lots of information about the fundamentals of keeping chickens. I think that lots of people who are getting chickens, and many people in the last decade have gotten what are called backyard chickens or small flock chickens, think they're a no maintenance pet. You sort of throw scratch on the ground and you collect an egg a day and that's it. And the sad truth is that lots of chickens will get various pathogens, injuries, illnesses through their lifetime. And unlike dogs and cats, which most of us have had and have experience with, or at least have access to a vet, lots of chicken keepers become their own vets. And so part of what I would like to do with a series of workshops is to support and educate other chicken keepers in basic flock management, but also what we call a health check. Chickens are vulnerable to predators, but also microbial pathogens, parasites, illnesses, and injuries, and some of those are one-off. So your chicken might get something and it's contained within that one chicken, but sometimes there are pathogens like respiratory infections, bacterial infections, parasites that can affect your whole flock. And so if you understand what's normal and you know what to expect from your birds, you can kind of predict what's abnormal. Yeah, catch things in the bud. And sometimes because chickens are a prey animal, they have learned to and adapted to hide signs of illness until often it's too late. By the time you see a chicken that's sick, sometimes there's nothing you can do. So when I go to my dentist and they ask me if I floss, I'm honest and say, no, I don't, but I do brush and I have, other protocols that I do. Ideally, probably it would be good if you could do this once a month with your birds, but realistically, unless you have a very small flock, like under 10 birds, it's probably not going to happen. But one of the things that you can do is start watching your flock. And a lot of the times you can see what's going on before you actually pick up an individual bird. And by that I mean, when you feed them, do certain birds run and grab the food and certain birds hang back? So that could be a sign that they're a less dominant or subordinate bird. It also could mean a sign of illness. Do you know what your bird should look like normally? So there's things like when a bird is walking upright in what's called a penguin stance. It's actually its attempt to alleviate pressure on the internal organs, and that's often a mass. And so people are thinking maybe my bird's egg bound. Almost always it's something else, and it's often cancer, egg yolk peritonitis, salpingitis, or even fluid that's pushing on the internal organs. When you go out and you look at your flock, and I have about 30 birds, and there's always going to be the ones that are the friendliest, the ones that are the most dominant, and you'll notice those ones. And then there's maybe the ones that are farther back in the pen, and so you don't notice those as often, but start looking for who hangs back, who gets the most food, because sometimes subordinate birds aren't getting enough to eat. I have more than one food and water station so that somebody doesn't get bullied out of that. Sometimes we're looking for that penguin upright stance. Sometimes it's, are they all fluffed up? And so when they are really puffed up, that's often a sign of illness. Lethargy. So are their eyes closed and they look like they're sleeping, but you come back 15 minutes later and they're still in the same position and they haven't opened their eyes. If they're actually moving kind of slowly. Often people will say, I knew my bird was sick because when I approached they didn't run and they allowed me to pick them up without a struggle. So when you're out in your pen and you happen to notice an unusual poop, especially if you've seen who's done it, take a picture. And then you can monitor that individual bird, and you've got the date on your camera that said when the picture was taken. So if it was yellow today, is it green 3 days from now? Or is it back to normal? If you don't know who's done it, you're going to have to do a little bit of detective work. Sometimes people find unusual things in the nest box. One of them is salpingitis. It is a bacterial infection of the oviduct, and it's often caused by there's egg material that becomes a host for bacteria, and what gets passed is called a lash egg. It's not really an egg, it's components of an egg and components of infection, and they look like little rubbery things, and if you cut them in half, you'll see this lamination of egg material. And if you know who has passed that one, that might help. Sometimes when they pass the lash egg, that's the end of the infection. It's all encapsulated within that, but sometimes they can't pass larger ones, and they get larger and larger, and then it'll lead to death. Feathers are a big one. We always associate birds with feathers, and so when you look at your bird, their feathers should be shiny, all pointed the same direction, they're not broken, they aren't ruffled, they're not missing big patches of them unless they're naturally molting. That's often a sign of illness as well. Feathers are made of keratin. It's a form of protein. And so often when birds are sick, they use that protein for other things, and then they have damage to their feathers. People have this idea that birds lay an egg a day, so you get like 300 and some eggs a year. This is not true. High production layers, so the kind that are used in big commercial farms, yes, they do lay a lot of eggs. They start early, they lay 6, 7 eggs a week, and they die young. They're often dead at 18 months. The kind of birds I have, heritage breeds, might not start laying till they're 7, 8 months old. They might lay 3 eggs a week. They take long breaks. So when it's hot, when it's cold, when they're molting, when they're broody, when they're raising chicks, they take breaks. But also if there's long periods for a hen in the time frame that you would expect her to be laying, that might be a sign of illness. I adopted a gold lace Wyandotte hen who was about 9 months old who'd never laid an egg. And her owner told me that, and she looked healthy, and I thought, okay, I'll bring her home, treat her right, she'll lay an egg. She never did, and the last week she was alive, she actually went into the nest box a few times, and I went in there right after, and there was no egg, and she went in, she tried to do something, she'd come out, and so when I actually euthanized her because she started to go downhill quite rapidly, the diagnosis was ovarian cancer. And about 30% of laying hens will develop ovarian cancer. And so the hormones triggered her to go into the box to do something, but there was no egg to be laid. This is Mercedes. She is an Appenzeller Spitzhauben cross. She has very kindly offered her services today. So this is what you would be doing in your health check, whether it's monthly, or you might be triggered to do a health check when your bird is actually sick. I scroll through lots of online chicken groups, and often the post says, "Help, my chicken is sick," period. So there's not a lot of information, so it would be really useful if you did the health check, you made a few notes, and then you posted those online. And you're much more likely to get a correct diagnosis. So what we're going to look at first are her feathers. She's got beautiful feathers. They're all shiny. She's not missing any. There's no signs that the rooster has caused any kind of mating injuries with feather loss. There's no cuts, nothing like that. Ooh. All right, so she's a little chatty today. So what we're going to look at first is the top of her head. If you notice, I have a bird that does not have a very prominent comb. Most of my birds don't. So if you think about foghorn, leghorn with that big floppy comb, if you had a bird with what's called a straight comb, you would be looking for, is it upright? Is it plump? Is it red? So very young birds and older birds, it wouldn't be red, but it should be when a bird is sexually mature and laying. Are there any spots? So are there any black spots that could be a sign of fowl pox? Are there little scabs that could be evidence of a pecking injury? Little cuts or abrasions. Sometimes there's a powdery white fungal infection called favus. So anything that looks abnormal. And so her comb is normal. Some people, think, oh, she doesn't have one, but she does. The next thing I'm going to look at is her beak. So are there any injuries? One time I had a hen that split her beak and I used a little patch from a tea bag and crazy glue and I fixed her beak. Chickens actually do have ears. And so they are behind here and she's got an ear. And so if she had an ear infection, you would expect to see swelling or inflammation, or actually like a dark plug of pus. So that's it for her head. So a chicken, if you know the phrase, as scarce as hen's teeth, birds don't have teeth. So they digest food by eating it, and then it goes through the esophagus into her crop, which is right here, this big bulge here. And so it goes there and it gets ground up in the gizzard. There's all kinds of really cool little pebbles and rocks that she's picked up in the yard, and they grind up her food, and then it goes through her intestine and out. But this big thing here called a crop, sometimes people think there's something wrong with their chicken because it is only on one side. It's on the right side of the body. It should be full and firm at bedtime and totally empty in the morning. So if you've got a bird that's sick, crate them without food or water, feel the crop at bedtime, and then feel it again in the morning before they've had access to food or water. If there's still stuff in there, there's something wrong. It's not moving. And so if it doesn't move, it could be a sign of a couple of things. One thing called sour crop, which is a yeast. Another is impacted crop. Sometimes they eat foreign bodies or lots of long grass, and that grass gets balled around and gets stuck in there. And if they've had an impacted crop for a long time and then it gets resolved, sometimes they have what's called a pendulous crop. So the muscle has stretched out of place, and then when the crop issue is resolved, the muscle still has lost its tone. And so when a hen runs, it actually does this, and you'll have to get what's called a crop bra to hold that into place. Okay. Sometimes when a rooster's mating, when he stands and he's trying to keep his balance, his spurs can cut. And so there could be some mating injuries under here, and often what you'll see is a patch of feathers that's missing on either side there, but she doesn't have that. So one of the easiest ways to hold your bird is like this, like a football. So you keep her wings close to the body so she can't flap, and her legs just dangle like that. And it keeps her kind of calm. You can also, if you were doing a procedure, wrap her in a towel. I think part of a health check is if you pick up your birds every month, they're more likely to be calm when you do pick them up, when you actually have a medical emergency. Right? If you have fussy birds, do it at night. Go out with a headlamp and you can pick one bird off at a time in the dark. They're really kind of calm and docile when it's dark. And they'll let you pick them up and you can go through things. Her eyes are really bright. She doesn't have any irregularities, so you're looking for changes in the pupil or the iris. You might have a graying or a clouding. Chickens do get cataracts. They do have blindness. There can be damage from pecking. And if anything is abnormal, take a picture and see if it gets better or worse. Another thing you can do is open up her beak and you can look inside. So they get plaques of canker on the inside. It's yellow. It's a bacterial infection and it can get bigger and bigger and can actually suffocate and kill them. So things like drooling or panting are a symptom of that. If they have sauerkraut, because it's a yeast infection, their breath will smell. So every chicken keeper knows that chickens scratch the ground and they get lots of damage to their feet. So one of the things you're doing is taking a look at the legs and feet. So you're looking for scaly leg mites, which are these little raised scales here. You're looking to see if there's any inflammation, anything abnormal. She has very clean, pink feet. There's no lesions, there's no black spots, there's no swelling. And that would be a sign of bumblefoot. She doesn't have bumblefoot. She's got a little bit of scaly leg mite, which she has been treated. Those are those raised scales, but not a bad case. There's no swelling. Those could be bacterial infections. It could be arthritis or gout. None of those. Knobbly toes, big swollen toes. If we lived in a place where it was really cold, we'd be looking for signs of frostbite. So frostbite can affect the wattles, which she has very teeny wattles and practically no comb. But if you have a bird with big wattles and comb, you'd be looking for signs of frostbite, and also on their toes. They turn sort of a yellowish color and black, and then unfortunately they become necrotic and fall off. We are going to turn her upside down, and we are going to look at her vent. In terms of the vent, what we're looking for is pink, no blood, no scabbing, no prolapse, no pulsing, and what you can also look for are external parasites. Mites and lice often congregate around the vent under the wings. And so you're looking for little bugs that are running, or with lice, they lay their eggs and it's a hard cluster of eggs at the base of the feathers. And her vent was totally healthy and clear. Chickens have all kinds of things that may go wrong, and lots of products that we have in our own medicine cabinets will be useful for chickens. So Epsom salts are one thing. It's called a salt, but it's not sodium. It's a magnesium product, so it's not interchangeable with table salt. Magnesium is actually an anti-inflammatory and works to draw infection out. So anytime you have to give a chicken a bath for an infection like bumblefoot, you would use Epsom salts, hydrogen peroxide, iodine. This product here, Vetricin, is wound and skin care. It's an antibacterial. You can get these in most feed stores. Any product that you are going to use on chickens' eyes should actually be formulated for the eye. Don't use any other product except something for the eyes, or even saline. Gloves, mineral oil, that's sometimes used for impacted crop, alcohol for cleaning supplies. I have a variety of different kinds of polysporin. There is kind of a myth going around that never use polysporin that has pain relief in it. I've talked to my mentor, who is a veterinarian with a master's in avian pathology, and said that is wrong. Actually, the amount of pain relief in this is not problematic for chickens and actually would be a good product to use. Something like trauma care, which is also a pain relief. Lots of times people think because chickens aren't screaming like dogs or cats, they don't suffer pain. They do. The reason they are not screaming is because as prey animals, they would be subject, to predators coming to find them. So meloxicam would be something you would get from your vet, but things like trauma care or polysporin would work as well. I'm really lucky that I work at a community health center, so often I get products from work for free. So I have these steri strips, which are good for wound care. I have some sutures in case I ever had to do stitches. I've got some scalpels, some plastic aprons, some lube, alcohol swabs, lots of different products, tapes, vet wrap that would be used to hold bandages in place. I've got lots of bandaging. There's vitamin E. There's emery boards, stir sticks. Those would be for beak injuries or nail injuries where you're having to file beaks and nails. These would be around splinting. There is this product which I got on the internet called Prid. It is a drawing salve. A lot of people actually do surgery and cut into their chicken's foot to remove bumblefoot, which is a bacterial infection. I actually would recommend not doing any cutting, but to use a drawing salve. And this is bentonite clay, and you can make your own drawing salve. There's lots of recipes online about how to make them, and you can use it on the foot to get rid of that infection. Tums are a source of calcium. So if a hen was actually egg bound, you would crush up the tums and put them in her water, and that calcium will help her lay that egg. A couple of other products are antifungal products that are used in women for yeast infections, and they can be used for vent gleat or sauerkraut. So last year I had a hen with vent gleat, and I went to the pharmacy and I didn't want to buy the most expensive product. I wanted to get the generic. So I talked to the pharmacist and said, is this product comparable to the most expensive one? And I said, it's for my hen. And I think I totally threw him because he went on autopilot into his script and asked if there was any chance she was pregnant. And I tried to explain that chickens don't give birth, they lay eggs. And then of course he was totally embarrassed. I'm not a vet and don't have training in animal medicine, but I've done numerous collaborations with other small flock keepers, as well as avian veterinarians, vet techs, and a medical laboratory scientist at a veterinary teaching hospital. Those relationships have served me well in keeping chickens, as well as understanding the various pathogens, parasites, and diseases that can affect them. My mentor is Dr. Vicki Bowes, Doctor of Veterinary Medicine and an avian pathologist. We have partnered to create 4 series together: Avian Pathology Cases, Tailgate Necropsy, Mythbusters Refuting Online Chicken Advice, and Ask a Poultry Vet. I want to be a source of information and support that backyard chicken keepers can trust. For that reason, I have chosen not to have sponsors or affiliates, which might influence my work. You can also find me on Instagram and Facebook under the name Bitchin Chickens Farm, where I post health issues, stories about my flock, and my chicken memes.